Good afternoon. So, those of you, some of you at the back row, could you give me a thumbs up if you can hear me well? Thank you. Thanks. Thank you. All right. Well, welcome to our 19th Wellness Trails event, which we started in 2017. My name is Kumara Sidhartha. I am a physician at Emerald Physicians. And recently, my role also changed to be the medical director for the Cape Cod Healthcare Physician Hospital Organization and Accountable Care Organization. And thank you. Oh, thanks. So this event that we started in 2017, it has evolved, the way we started it and how we are doing it now, largely thanks to you, because the feedback that you have been giving all along has helped us to design this differently to meet your needs. Because of your feedback and what you have asked for, what kind of topics you wanted, all of that has shaped the design of how we are doing this. In fact, this is today's topic, which is how to transition to a plant-based nutrition, is one of the most requested topics. So that's why we'll start the year with that, and it's a good time to start. A lot of us are thinking about a new year and taking up new positive behaviors. So I think we thought it's a good timing to start. And over the past two and a half years, we have done a variety of topics. We have covered heart health, gut health, joint and back problems. We discussed dementia, diabetes, women's health, men's health. We covered a variety of behavioral health concerns, anxiety, depression, sleep issues, cancer prevention, healthy aging, and more. And when the way we have designed it is to bring topics that matter to you. We bring experts in the field related to those topics, Cape Cod Healthcare physicians and specialists involved in that. Plus, we also bring community specialists and providers in fitness and nutrition and wellness entities. So it's an idea of bringing all the assets that are valuable for you, that are available in the community, by creating this forum. And the mission always has been to educate and empower the public so that you can take care of your own health. And I would also want to just thank the team, the AV team here, where is Reese. He also always makes sure that the tech troubles don't show up for us. And we also have a nursing team from Emerald Physicians and Cape Cod Healthcare doing some screening blood pressures here. Thank you to those. And obviously for Cape Cod Healthcare, which, if you think about it, if people are diseased and sick, that's good for business, right? So the same Cape Cod Healthcare is making sure that they fund such a beautiful venue, sponsor these events, and make sure that they do address the concerns of the public in terms of preventing diseases. So a lot of gratitude to Cape Cod Healthcare as well for making this happen. Some housekeeping notes: there are snacks on both sides, water. The restrooms are outside the door to the right. And for Q&A, I would encourage you to, if you have questions, you have pen and paper so you can jot down the questions during the presentation. We try not to encourage questions in the middle of the presentation. Just if you can hold it off until the end, it'll be good so that we can keep on time. And there is going to be a break, 10-minute break after the third presentation around 3 o'clock. And at the end of the sessions, each session, at the end of each event, we usually do a survey, and I'll talk more about it as we close. So we'll move on to my presentation. I'm going to kick off by discussing weight loss, but I want to give the context of how um, I see weight loss as not just a standalone opportunity, but an opportunity where you can take care of other aspects of your health as well. So it's not about just watching the weight, but it's also about simultaneously, while we are taking the initiatives to make sure that you don't get cancer, make sure you don't get diabetes, you don't get arthritis, and heart disease. So how can we make it a one-stop shop? You know, when you're trying to put some effort in making a change in your behavior, how do we make sure that we're not only addressing weight loss, but taking care of other concerns as well? Because the way the way I would approach it, and I would encourage you to look at, is to see how can we go at the root cause of all of these problems, so that when you take care of one issue through your efforts, you're going to take care of a multitude of things at the same time. So I'm going to start with, I want to address some of the, I mean, I've been doing this for many years. You know, I've been doing this nutrition work for nearly 20 years. I've been a doc for 25 years. Initially, when I was trained in medical school in India, and during my residency training here as well in New York, we really didn't get taught so much about nutrition and its effect on health. And this is more self-taught. And then I started attending conferences. Then I realized the value of it by starting to work with my patients, and I saw dramatic improvement in their health. So I wanted to learn more, so I went on to do a master's in public health nutrition. So that's all history leading to where we are, and what my understanding is, which I want to share with you. And one of the common myths I've always heard about all along in my career working on nutrition is that the concern, or the myth, I would say, that plant-based nutrition, or foods that are plant-based, or have lesser quality protein, have less nutrition, and so forth. So there has been a large body of evidence that has looked at it more thoroughly over the past 2 decades. And we do know that plant-based meals contain a higher quality in terms of nutrients that we want to prevent many of the diseases than animal-based foods. And when I talk about quality, in the scientific literature, when they talk about quality, what they mean is that they use a standard tool called Healthy Eating Index that has been revised. The last one was in 2010. So they look at, which meal patterns, which meals have a large amount of nutrients that are helpful to us, and at the same time, whether they have a lower amount of components that are harmful to us. It's really about the ratio they look at, so whether we have more good and less of the harmful stuff. So that's what really is designed into the principles of measuring quality using the Healthy Eating Index. And some of the studies you're going to see are all, it's all like the first few slides, it's hot off the press, literally, like these were released in this month. So this was published January 8th, looking at diet quality of vegetarian diets compared with non-vegetarian diets. It was a systematic review, which means they look at all the data that has been published over the years, and they compile and see what kind of patterns emerge. And they concluded, basically using this Healthy Eating Index tool, that vegetarian diets and vegan diets have a higher diet quality than non-vegetarian diets. And that includes looking at um, nutrients that are like antioxidants that helps to prevent cancer, and protein quality, um, the amount of healthy fats like omega-3 and omega-6. So all of that is considered in this analysis when they make this decision. The other aspect, which when we talk about weight loss, is that plant-based meals have been shown to curb excess appetite, and also they provide a feeling of fullness and satisfaction that allows us to feel satisfied and not eat excess calories. Uh, it really boils down to, are we getting the right nutrients, and are we avoiding eating too much calories, if we want to make it really simple. And in order to achieve both, plant-based meals helps that. And with regard to the appetite, there has been a lot of understanding in the past 10, 15 years in, in how the body regulates appetite, what makes us want to eat, and then what makes us that on-off switch for appetite. So there are some hormones that have been discovered that are secreted by intestine, the small intestine and stomach, that actually regulate our appetite, and that's the on-off switch. And so pharmaceutical manufacturers also looked at it, and now they have made medications, pharmaceuticals that are working to mimic some of these hormones. If you are a diabetic, and if you have anybody in the family or friend who has diabetes, you might have heard of some of the newer medications for diabetes, like Trulicity and Byetta injections. A lot of the new ones that have come about, they actually work by mimicking one of the hormones called GLP-1, um, glucagon-like peptide, which helps to reduce the blood sugar after we eat. Like when we eat food, the sugar goes up. And this hormone, which is naturally secreted by our small intestine, actually helps to not only curb the appetite, but also it helps to release insulin from the pancreas. It helps the liver to not produce too much sugar that gets into the bloodstream. So there are multiple mechanisms these hormones work. And so pharmaceutical industries have looked at molecules that can mimic that. So we have a whole slew of medications that have been um, released in the past 5 years, I would say. And obviously, there is some downside. I mean, there are some patients who really need it, but there are downsides that come with using medications. Yeah, it is an injection; you have to inject it. There are side effects associated with that. So, is there a way to actually can we kind of not go to injections and medications? Can we increase the GLP-1 to work better? Can we increase these hormones to work better? And that's what this study looked at. Again, hot off the press, just published January 12th this month, looking at plant-based meals and compared with meat-centered meals in patients who have type 2 diabetes, and patients who are overweight, and in healthy control group. Looked at, what you're seeing here, the three groups are, the diabetic group, obesity, and healthy groups. The color in the bar is the orange one is the vegan diet. M stands for the meat-centered diet. So they measured satiety. So that satiety is feeling satisfied, feeling full, that you want to stop eating. So that was, as you can see in the orange bar, it was higher in the plant-based meal group, in diabetics, in healthy individuals, patients who are overweight, obese. Again, they measured the blood level of the GLP-1 hormone, which again was seen to be higher after a plant-based meal. In diabetics, actually the response was much better in diabetics compared to others, but across the board, compared to a meat-centered diet, a plant-based diet clearly showed that this GLP-1 hormone, which now patients are going and buying injections and having injections done, can actually naturally increase by making choices that are more plant-based in our meals. So the way I want to present this data is I want to show some small number of anecdotes, my patients' stories, but I also want to tie that in with how that fits with the large amount of evidence that is available in science that confirms or validates what we see with our patients. One of the reasons why I really went to do an MPH in nutrition was to really understand how nutrition research is conducted, because there is so much confusing headlines, news that you would always hear. Every month there is this superfood of the month that comes out in the news, right? This month it's blueberry, next month it's pomegranate, and some things you don't even understand or recognize. So there's so much confusion in the nutrition science out there. And so I really want to understand, I wanted to understand it better before I talk to others about it. And that's one of the reasons I wanted to know how the research is done. So when I went through the training with Masters in Public Health, we are really taught how to actually conduct the research. And we also know how to kind of analyze a study to understand, was it done well, or was it just put together to want to show some results, specific results? Was it a biased study? So all of that led to my understanding of how to cut through the confusion in the nutrition science. And that's one of the things I want to bring it to you by sharing evidence that is a large amount of data, but also kind of connecting it with real patient stories that I've experienced with my own patients. So this is one of my patients who used to be 265 pounds. That was in 2013. And his blood pressure was high, 158 over 94. I worked with him for probably 10 months, switching to plant-based diet. And if you see this gentleman, he's you would not. I was actually floored that he actually followed my instructions and started eating. So he's a biker dude, tattoos all over, and that's that's how you would see him. And you never think that he's going to be eating tofu and black beans, and starts to love it, actually. So he really made a big change. His weight dropped from 265 to 191. He went under 180, actually, down the line. This is an old data I'm using. Blood pressure dropped to 108/62. He had a back issue. He was on opioids for it. He was able to reduce the dose of the opioids. His back got better. His quality of life improved tremendously. Originally, because of the back pain and his weight and the knee issues, he will go to work. He used to do a night shift. He will go to work, come back in the morning, and he can't sleep in the bed because of his back, so he will just sleep in a reclining chair, and that's what he had for life, basically, until after all of this, his pain improved, his weight dropped, and he's back doing the stuff he wants to do. His quality of life improved tremendously, and he's thankful for the food that is changed to eat. So I wanted to put that case study before I did this discussion to talk about pain and inflammation. If any of you are not aware of what inflammation means, it is a medical term. In simple terms, the way I describe that is, it is a response that the body produces in response to any kind of insult that the body suffers. So if somebody bumps into the table, you get a little bruise, there's a little bit of swelling there, it's warm to touch that area, it may look red. So all of that is because there's more blood flow coming to that area, and that blood flow reaction due to that physical injury is inflammation. if somebody gets a viral infection and they're coughing and they get like a bronchitis, that is inflammation in the bronchial tubes in response to an insult, but in this case, it's a virus. So it's any kind of insult and response by the body, and that's inflammation, right? So it can be somebody who's a runner who keeps injuring their knee repeatedly when they were young, and then they develop a premature arthritis when they're 40 or 50. Again, there the injury is a physical injury, sports injury, a response is inflammation, arthritis. So it's arthritis, bronchitis. So anything that ends with itis basically is inflammation that in our terms. So one of the other insults that our body suffers, which leads to inflammation, is our breakfast, lunch, and dinner, and snacks. So, and we do that every single day. Um, and then, so that leads to a kind of an undercurrent of inflammation all day, all year, which is now known to be a really a pivotal mechanism by which many of the major diseases that we see among our patients in the community, including cancer, including diabetes, heart attacks, arthritis, all of those chronic diseases are connected by a common thread called inflammation. And that's why I want to just make sure that we spend enough time there to help you understand it, and also take you to a place where you understand how choosing the right food choices, choosing anti-inflammatory foods actually helps to prevent the inflammation, or if somebody who already has arthritis, to kind of minimize how quickly it can deteriorate in that joint. So this slide is basically just showing what I just said. Chronic inflammation is kind of a connecting thread, an underlying mechanism in many of the diseases that we see, including Alzheimer's, arthritis, cancer, heart disease, autoimmune diseases, and so forth. So that's what I said. When I said one-stop shop, you take care of food and take care of the inflammation, it's going to help you to take care of many of the other issues. So this is, again, hot off the press, published in just December 2018, a month ago, and endorsed by the American Heart Association and American Stroke Association. The study looked at the anti-inflammatory effects of a vegan diet versus the American Heart Association recommended diet. So the AHA is doing a study with their own diet, and they're comparing it with a vegan diet, and they published it honestly, and that vegan diet works better, basically. So this was published 2018. This was December, a month ago, published in the Journal of American Heart Association. Vegan diet resulted in a significant 32% lower C-reactive protein, which is an inflammatory marker. We can test it in the blood when compared to the American Heart Association diet. And the results, so this is what I wanted to put this in, because when we look at diet studies, there is a lot of ways you can actually, if a researcher wants to show a result, they can design a study to show that result. And that's one of the reasons I wanted to do the MPH, to figure out, where is who's doing it correctly. So if a study does show a result, and they made sure that result was not influenced because of difference in age between the two groups, or difference in the race, or the baseline weight, or baseline diabetes or no diabetes, or a history of heart attacks. So in other words, if they have adjusted the group so that one group doesn't have any advantage over the other, and then did the study and analysis, that's a more reliable study, and that's how this was done. And this was looking at the effect of plant-based diets on obesity-related inflammatory profiles. This was a systematic review and what we call as meta-analysis, which is really looking at all the studies that have been done, and they kind of look at if there was like 200 studies done looking at this. They will look at it and say, okay, which studies are actually done in a correct way, which are clean studies. So they will remove all the studies that are not done well, and then they will look at do a statistical analysis to see what is the evidence that is collectively being shown by all these studies put together. That's what is a meta-analysis is. So this is better than one study, because sometimes you will hear a headline and news that will say one study, a small study that was published somewhere, which kind of shows something entirely different. For example, eating butter is going to help your heart disease, right? So there might be one study that has been done in some tweaked way that is showing a result that is against what we know from 200 other studies. That'll get a headline in Time magazine and whatnot, and people, it can change the public behavior. So I think it's important to see what does the totality of the evidence point to, not just one or two studies. And so that's why I think these kind of systematic review and meta-analysis have a more profound influence in how we decide on decisions, how we recommend things. And this was published again this was 2016, basically showing plant-based diets are associated with an improvement in obesity-related inflammatory profile, which kind of ties in with the other study that I mentioned. So when we have inflammation and problems with insulin and pre-diabetes, diabetes, overweight issues, one of the organs that actually takes a hit, but it's not discussed as much, is the liver. So the liver can develop what's called as a fatty liver. And the fatty liver can develop either because of too much alcohol, or it can develop because of a diet. So it's called a non-alcoholic fatty liver disease, NAFLD we call it. So, and it can lead to, the danger with that is that disease can lead to a fibrosis in the liver, where the liver can become scarred, and it can actually lead to a liver failure, which can be fatal in some folks. So I think it's basically an over too much excess calories that is not actually helping, right? The French food delicacy foie gras, that's a fatty liver. You take somebody and overfeed them to create a fatty liver, and we all are doing it without somebody forcing us to do it. That's the only difference, right? So this was a patient who was 73-year-old. I like, where is Amy's? I like the Amy's slides, which says 73-year young patient. So I should change mine too. 73-year-old patient who had a liver scan which showed a moderate amount of fibrosis. Weight was above the normal weight range, and so this patient attended the shared medical appointments that we do, and switched her diet to a whole plant-based diet, lost 39 pounds over a period of a year. And then we did a liver scan again, which showed no fibrosis. So this patient was actually able to reverse the fibrosis. This is basically, a lot of details there, but basically the scores are, this is the liver stiffness score. We call it a liver stiffness score. The higher the number is, the more fibrosis is happening, and the liver is becoming stiffer. So you can see that after 1 year, her liver stiffness score dropped. The fibrosis got reversed. And actually, to my knowledge, this is the first case I've seen or read about where a fibrosis in the liver was able to be reversed just with diet. We also know that plant-based meals can prevent and can be used to treat diabetes. So what I decided, there is so much data in diabetes, I didn't know how much I can pack within this time frame I have. So what I did was I just went to the headquarters, to the main source, which is the American Association of Clinical Endocrinologists. So this is the national official organization for all the endocrinologists, and they put out the guidelines, the last guidelines they had out, that was in 2015, for physicians in telling them how to treat patients with diabetes. So that was basically, this was one of the first recommendations they look at, was diet, and in that again they mentioned um, consume plant-based diet that is high in fiber, low in calories, low in sugar, and high in antioxidants and phytochemicals. So what they are talking about here, I wanted to put this out here because this is basically is what is looked at. Remember in the first slide I talked about high quality diets using the healthy eating index tool. That's what these measures are. They look at which diet has more fiber, which has lower calories, which has high antioxidants. So the same thing. So, you know, so basically the official recommendation of the Endocrinologist Association in this country with regard to diet and diabetes in terms of preventing and treating is to consume plant-based nutrition. There are some studies. This was looking at 200,000 men and women who were followed for 20 years, and what they did was they followed their dietary patterns and their disease outcomes. So these are people who didn't have diabetes to begin with. They get enrolled in the study. They are followed for 20 years. Every year they get blood tests. They're enrolled in the study, and they're saying, which diet led to preventing diabetes. And they found that a healthy plant-based diet, which is what is mentioned there, reduce the risk of developing diabetes by 34%. And this was after following for 20 years. This is the kind of studies I like. You need a large sample size, 200,000 men and women. You need to follow for 20 years, rigid design and research, and those are the things we need to rely more on. This was a study that looked at Loma Linda in California, which is one of the blue zones in the world. Blue zones are cultures in the world where people on an average live up to 100. So in other words, they are like 102 and they're putting roofs and building houses, right? So these are, so in other words, just what I'm trying to say is that it's not like they're living up to 100 and they're on wheelchair and they need to be moved around. These are people who have the vitality. So Loma Linda in California, which has a large population of Seventh-day Adventists who, based on their religion, some of them are vegan, some of them are vegetarians, they don't smoke, some of them do. So that's a great kind of a living lab for researchers to kind of study the different populations among them. So this looked at nearly 90,000 Adventists. They pulled data from 3 studies. These 3 studies together and found that the risk of diabetes in people who don't eat meat or fish, but they eat dairy and egg, the risk dropped by 60%. And in the group that actually gave up the dairy and egg, just stuck with fully plant-based vegan foods, the risk of diabetes dropped by 80%. And this is a patient of mine, which I'm going to probably just quickly go through that patient. This patient, when I first diagnosed this patient, his blood sugar was 415. His A1C, which is a measure of diabetes control, was 11.7. Normal should be under 6% in that. Normal blood sugar should be like 60 to 100. So very high blood sugars, uncontrolled, shifted to a plant-based nutrition. After 2 weeks, his sugar started to drop. This is a gentleman who did not want insulin, who did not want medications. So he wanted to just use diet to treat it. So he basically reversed his diabetes over a course of a year and a half. His A1Cs dropped under 6. His blood sugar was around 110, 100, and went even further down. This just, sometimes it's good to tell anecdotes and combine them with the big, large data. So that's why I'm showing that. So when somebody has high A1C, A1C is the blood test they do for diabetes. And now we know that A1C is actually a measure of aging. So if somebody is 40 years old, they have diabetes, and they have an A1C of 11, 12 high, that means their system, their body is not 40 years old. They are like plus 50 plus. So in other words, A1C is a measure of the systems degenerating faster and aging faster. It also is been shown that A1C is linked, higher diabetes is linked with a risk of developing dementia. So, which also goes with aging as well. So high A1C means three things. It's worsening diabetes, it's aging faster, and dementia arriving sooner. So, which, this slide basically shows you can go from having a good memory and independence and you're able to drive and choosing unhealthy foods, getting inflammation, pre-diabetes, high A1C, and developing dementia eventually, and having to lose independence, giving up your driving license and all of that, which nobody likes. All right, high blood sugar this is my sound bite of the day. High blood sugar is the wrinkle in your blood. That is a sign of aging. And if you want to stay younger or delay aging, we need to make sure that diabetes is well controlled or prevented through reducing inflammation and prediabetes by making the right choices in your food that has a higher quality that like we talked about. I think okay. Plant-based meals can shut down your bad genes. If somebody is born with a breast cancer gene, they're born with a prostate cancer risk because their parents have, the dad has prostate cancer, sister had breast cancer. Plant-based diet can actually shut down bad genes and turn on protective genes. So this was a study done looking at gene expression, which is basically meaning can we shut down the gene and turn on the good genes. 31 patients followed for 3 months using a 100% plant-based diet, stress management, moderate exercise. After 3 months, they found 48 cancer-preventing genes were turned on, and 453 cancer-promoting genes were turned off. And this was published in 2008, Proceedings of the National Academy of Sciences. Even though it's a smaller sample and a shorter study, I did include this because of the power of the effect that we see, that something, because it was clearly shown on the left side what you're seeing, this set of genes and this set of gene study, they are exactly the same. But you will see that on the right side, there's a predominance of green, which is basically all the bad genes being turned off on the right side. So same genes, you can shut down the bad genes by dietary changes. Plant-based meals can prevent and contain cancer. For this, there is tons of data. So I said I'm not going to pull all the data. I'm just going to go to the authorities and show what they're saying. So American Cancer Society, eat a healthy diet with an emphasis on plant-based foods. World Cancer Research Fund and American Institute for Cancer Research, again emphasizing whole grains, vegetables, fruits, and beans to make it a part of your usual daily diet. Excuse me. This is a study that showed how animal protein can actually increase the risk of cancer by increasing a particular number in your blood called insulin-like growth factor 1, IGF-1. So on the black bar, you have a high amount of animal protein. On the blue bar, you have a little less of animal protein intake. And the gray bar, you have a smaller amount of animal protein. So as the dose of the animal protein in the meal increases, the risk of mortality, death, increases along with the blood level of insulin-like growth factor, which has been correlated with promoting tumor growth. Okay, so checking with the boss to see if I have time. So we have, this is a video talking about dairy. I get a lot of questions about dairy products because historically, you grew up being hammered with a message from TV and advertisements that milk and dairy products are important and indispensable for your health. And I'm here to say that it is not true. That you could get all the nutrients that you need for your bone health without dairy and through greens and beans. And it even rhymes well so that you can easily remember. So just remember greens and beans. You can actually get the calcium, the potassium, the magnesium, and the vitamin K that you need for your bone health. Additionally, you need vitamin D, for which you need to go to Florida in the winter. No, I'm just kidding. Vitamin D, in our geography, we need to rely on supplements for certain, actually at least 6 months of the year. And then the rest of it, calcium and all, you can get it from greens and beans. So this is a video. Is there a click?
Casein is a chemical carcinogen. Some chemicals in our environment qualify as carcinogens. That is, they cause cancer based on testing them in experimental animal studies according to criteria set forth by our government. Such a study has one control group, that's no chemical, then 2 or 3 treatment groups, each with increasing amounts of chemical, usually far above the amount we humans might experience, in order to be sure that it does not cause cancer. Take a look at the graph. A cancer-causing response shown here as dependent on level of chemical consumed is then used to estimate which levels of carcinogen exposure might be of concern for humans, shown in the small green box on the lower left. But estimating likely human response is virtually impossible because the rat carcinogen levels are usually orders of magnitude higher than typical human experience. In our experiments over 25 plus years and published extensively, we showed that casein increased experimental cancer at levels within the range of human experience.
So casein is the predominant protein in any dairy product, whether it's yogurt or cheese or milk. Casein, you heard of it? So this is Dr. T. Colin Campbell, who taught me in Cornell on nutrition, clearly saying that casein is a carcinogen, the most potent carcinogen that humans have come across beyond nicotine. I think so. These are some strategies I put down there to prevent cancer using diet, and how plant-based meals can actually help to work on all these 6 areas of cancer prevention. Right from, if somebody already has cancer, their cancer spreads to other organs because the cancer is able to put down new roads and highways to travel to the brain, to the liver. It puts new blood vessels. It's called angiogenesis. Genesis is new creation. Angio is blood vessel. Cancer cells can create what's called as angiogenesis and travel wherever they want to travel because they're putting their own roads to travel. So plant-based meals have been shown to shut off those highways, cut off the new blood vessels that is allowing the cancer to grow and spread. And plant-based meals have the antioxidant capacity to prevent the cancer from happening in the first place. Remember the IGF-1 that I showed with the animal protein? Again, cancer can be prevented by plant-based meals because it doesn't lead to excess IGF-1. And also, every cancer cell starts because there is a break in the gene, in the DNA of the cell that leads to that particular cell becoming a cancer cell. And plant-based meals have been shown to minimize those breaks in the DNA. It's more, I can go into this, but this is a slide just to give you an understanding of what are the different types of diets out there, starting from non-vegetarian to a whole plant-based, and a lacto-ovo, where you can, it's including the dairy and eggs, but no fish, no meat. So just to give you a reference point, you don't want to stay there. And this is another study that showed that adhering to a high-quality diet, healthy diet pattern like the plant-based diet improves mortality among cancer survivors. And there's a couple of studies I put in for prostate cancer prevention, and even actually after developing prostate cancer, studies have shown that dietary intervention to modulate or arrest the growth of prostate cancer, again, vegan diets or eliminating sugars, both when accompanied by weight loss, has been shown to arrest the progression of prostate cancer in men who have been diagnosed with prostate cancer. And so I just put some examples, like, when we talk about plant-based nutrition, the idea is we always have this myth that they are not tasty, they're hard to prepare, and hopefully the other speakers today lined up are going to show how it is not true. And so that's some of the meals I make. And so just wrapping up again, when we think about weight loss, one of the things I want you to think about is it's a one-stop shop. Don't just aim for weight loss. Aim for something that is going to help you in your totality of your health, not just your weight, but look at cancer, diabetes, dementia, arthritis, heart attack, and everything. I didn't touch much on heart disease because we have a cardiologist, Dr. Thompson, who's going to talk about cardiology aspects in the plant-based meals. I think that's pretty much it. That's my prescription. You can see that the portion size is different for different components there. And there are some additional resources you have there. Yeah. 3 questions. So 3 questions.
So the slide that you just had up that gave the 6 strategies
Yes.
mentions
Go back to that.
excess estrogen from excess body fat and alcohol. Can you talk a little bit more about the role of estrogen in all of this? And then if there's time, do you believe that sugar is the new tobacco?
So this was on the excess estrogen. So yes. So one of the problems with excess body weight, and again, when I talk about excess body weight, it's not about appearance and vanity and looks. It's really about a health risk that we're talking about. And one of the reasons we talk about that is the excess fat in the body. Those individual cells they act like a hormone, like a gland. Like we have thyroid gland that produces thyroid hormone, right? We have adrenals that are producing adrenaline, noradrenaline. Likewise, these fat cells produce estrogen. So they produce excess estrogen, and when the blood level of estrogen is higher than where it should be, that increases the risk of breast cancer in women. So that's one of the reasons why excess body weight is now considered as one of the strongest risk factors of breast cancer, and so that's the explanation there. What's the other question? You got another question? Is sugar the new tobacco? I think sugar is fitting into the idea of, that I talked about the diet quality, a meal that has components that have poor nutrition and just calories, which is bad. And that's where the sugar comes in, just calories. There's no other additional benefit to it. So that's why it is a contributor to calories that are not bringing in any benefit, and it could tip the scales towards excess calories, which leads to all the other problems we talked about.
Yeah. There was a slide that went by quickly, and I didn't quite catch it. It was something about cooking methods and high heat and low heat cooking. Was something about it was better to cook with lower heat than high heat. There was something that went by real quick, and I was wondering what that was about.
It could be a future next presentation slide maybe out there.
Oh, okay.
Yeah, I don't think I included that. But we can talk about that later on in heat. All right, well, moving on.